Hi, my name is Noor. Welcome back to my channel. In my last video, I talked about an intro to diabetes, so talking about symptoms, causes, and then basic prevention and management plans. But in this video, we're going to be going more into depth on insulin resistance specifically. So if you haven't seen my last video, I recommend you check that out first. So let's start this video just describing what is insulin. So insulin is a hormone released by the pancreas with the function of helping your cells take up glucose. So in a normal, healthy body, what you'll see is that when you eat something, you're gonna have your blood sugar levels rise, and then the pancreas is gonna release insulin so that the glucose in your blood can be taken up by the cells, and that'll be used for energy later on. Someone who has insulin resistance, however, is gonna have some sort of issue where the bodily cells aren't effectively responding to insulin. So that means the blood sugar levels stay high, and then you're not going to be able to use as much glucose for energy later on. So more about the science behind insulin resistance. Well, insulin is going to bind to receptors on the cells, and that's going to be what initiates like a cascade for the glucose to be taken up. But those who have insulin resistance have defects in that signaling pathway. And insulin resistance can occur to a lot of different factors. For example, you can have obesity occurring, genetic factors, and then also physical inactivity. For more about like the symptoms and the causes that I mentioned, one, genetics. You'll see this as in a lot of diseases, but your family history has a big role in your overall health. Two, obesity. So if you're not exercising enough, then you can build up a lot of fatty tissue, especially around the abdomen, which can cause inflammation and ultimately insulin resistance. Third was physical inactivity. You should be having about 150 minutes of exercise every single week if you want to be able to maintain proper health, but lack of exercise can make you more prone to insulin resistance. For diet, I covered this a little bit in the last video on what you should be eating. But if you're having too many carbs, too many sugary foods, alcohol, or smoking, then that's not good for you, and that means you're more likely to have insulin resistance. 5, age, and 6, hormones. I'm sure those ones are a little bit more common with other diseases as well, but those are a little bit associated with other diseases too. So 4, symptoms and diagnosis. Insulin resistance itself doesn't have its own symptoms, but what's common is you're going to see that the symptoms of diabetes are also there with insulin resistance, because insulin resistance often leads to prediabetes or type 2 diabetes. So what you're going to see is increased thirst, frequent urination, fatigue, or blurry vision. If you see any of those symptoms, you should probably talk to a doctor, and then diagnosis is going to mean you're going to need some testing for that. So insulin resistance, like I just mentioned, it has a lot of implications in terms of being a factor that leads to diabetes, but it can also correlate to cardiovascular diseases or non-alcoholic fatty liver diseases, or like metabolic syndrome, which is a cluster of conditions that include like high blood pressure, high blood sugar, or a lot of body fat. So insulin resistance leads to more problems than just diabetes itself. So it's really important that you know about how to prevent and manage. 6, so management, it goes back to the causes a lot. If you're seeing you have room to improve in terms of how much you're eating, what you're eating, your exercise plan, having a more consistent schedule, I think those are the major ways for treatment other than seeing a physician and getting medications prescribed. 7, those are the major ways for treatment other than seeing a physician and getting medications prescribed. 7, living well is going to be one of your biggest keys for preventing insulin resistance. So if you wanted and you had diagnosis, you could join a support group, but it's really important to know that setting realistic goals is key, but also you should definitely celebrate small successes and know that managing a chronic condition, it's stressful, but small steps in the right direction are worth it. So that was all for today's video. I know it was a lot of information, but thank you for staying till the end. If you had any questions that you'd like for me to answer or any topics you'd like covered in a future video, please comment down below and I will be sure to look at those. Thank you so much.